Now this begins Lecture 1. Lecture 1 in this class, we're going to talk about the microorganisms that you're concerned about when you're dealing with in an emergency with the fluids that may be given off or you have to deal with from the person you're handling. We're going to talk primarily about bacteria and viruses. These are the two mechanisms that would normally transmit the disease. We're going to break them down for you and to show you what they are and how you can deal with them. Now you see our next slide. We show you the mechanisms of disease transmission. For a disease to be transmitted, there has to be a source of the organism, a susceptible host, and there has to be a means of transmission. Now we're going to take a look at each of these in order. We're going to show you how they work and to show you how you can deal with them using what we call standard precautions as you deal with emergencies and emergency situations. See our next slide. Moving in here, this is the transmission of microorganisms. As you can see from this slide, we have just a few ways in which they can be transmitted. First thing we're going to look at is horizontal transmission. Vertical transmission is when we're talking about a mother and a baby moving across the placental barrier. Here we're going to be talking about horizontal transmission. That occurs in three ways. Direct contact means you are touching the person or you've had some physical contact with the person. Indirect contact, when you get some of the material or some of the microorganism from a secondary source, an inanimate object, a table, a chair, or a glove. And then we're going to talk about droplet transmission just very briefly, which is kind of rare in dealing with these types of organisms, but we will give you some overview of the primary methods of transmission that you have to be concerned about. And here is our next slide. We're also going to talk about the susceptible host. The susceptible host is that individual who has some limitations on their biological system, which is normally designed to resist these microorganisms, which makes them liable to receive the organism and to give it a bed in which to grow and to evolve. We're going to talk about compromised immune systems. We're talking about procedurally induced tissue damage, some types of cuts or nicks, presence of intrinsic infected foci, something that you may ingest. Surface integrity, picking up off an indirect surface, and the number and type of infectious agents where you have to have enough of them to overcome your system so that your system will then become infected. These are the ways that we get a susceptible host. And here's another slide. Things to remember when you're dealing with microorganisms. If something goes wrong, don't panic. If there is a tear in your protective equipment, simply deal with it. We're going to talk with you about the precautions, how to deal with hand washing and insecticides and disinfectants so that it will not be a problem. Follow your standard precautions. Always use your personal protective equipment. It will prevent most of these issues. And nothing happens instantaneously. If there is a problem, it is not going to be something that is going to cause an instantaneous problem. You will have time to deal with it, and we're going to talk with you a little bit as we go through this course about how to do that. Now in this lecture, we've covered all the transmission mechanisms. We've explained to you how they work. We've talked with you about the different types and ways and about the cycle that needs to be in place for there to be a successful transmission. We're going to move on to our next lecture.